Okay. Welcome. Nurse Andi is giving us a talk tonight on low-dose antigen therapy that we've been doing here now for 4 years, maybe?
Yeah, I think
Yeah.
so.
It's crazy miraculous, and we're really lucky to have Nurse Andi here doing this, and it's changed a lot of our lives, and so we thought we'd do a little reminder redo on for the people who haven't yet tried LDA to sort of understand what it is we're doing. And so, Nurse Andi.
Hey, thank you so much, Dr. Keller. So welcome everyone. And low-dose immunotherapy and low-dose antigen therapy is what we're going to kind of talk about tonight. And you know, it's been one of those interesting things. I wanted to start off by simply thanking my friend, Dr. Harani. Karima kind of talked me into treating my own daughter who was anaphylactic to cheese, which was really not fun. And we managed it at first, but as school, you know, EpiPens and school notes and every single class outing, it became such a hassle. And then, you know, all of the patients here and Dr. Keller really helped me through the learning curve, because when I first learned this therapy, it wasn't quite the same in class as in practice, and so I was just really grateful to have such a supportive team that could help with all of that. And a little bit about the history is, like a lot of amazing things, it was an accident. Dr. McEwen was an allergy specialist in England, and he was trying to heal nasal polyps by doing beta-glucuronidase injections in people's noses. And they were like, well, the polyps are still here, but my allergies are better. And he coined the term enzyme potentiated desensitization, which was mostly for things, antigens are things we find outside of our bodies, like foods, pollens, grasses, danders, chemicals, those types of things. And then in the 1990 timeframe, Dr. William Schrader kind of brought LDA as EPD to the States. And at first we were able to get the antigens from England, and then we weren't. So he had to recreate all of them and did that. And I learned originally from Dr. Schrader and the American Academy of Environmental Medicine, and they had a lot of rules. There were a lot of things that you couldn't do and you couldn't take, and you had to do antibiotics before you started, and you couldn't think about any bread except for the one potato roll from, you know, Iowa that you could fresh order in. And it was just like, I kind of got overwhelmed by all the rules, because I couldn't do it for my child. I couldn't get my daughter to follow those rules. I personally, as an adult, couldn't. And I was like, well, okay, let's try it. And then I got to meet Dr. Ty Vincent, and he and Dr. Harani, well, Dr. Ty is amazing, and I got to mentor with him for a couple of years, and he's a rule breaker. He's like, you know, retired Army medical physician living in Alaska. Now he's down in Hawaii, which I had done that transport too, so I kind of just liked his irreverence, you know. But he also started making his own, and so he started looking at things like Lyme and co-infections and indoor black mold and, you know, food colorings, and started creating the global immunotherapy work. And then Dr. Harani was more of a, she works with more kids on the spectrum, and she works with a lot of PANS and Panda cases. And she was kind of stretching in this other really interesting way of doing things like histamine and histidine. And, well, I don't want to give this medication, so we're going to do an LDI and see how that does. And so I kind of like took from everybody and kind of remembered my background in German functional medicine, which nosode therapy is the therapy of infections outside of us. And so this has been done for many hundreds of years. And so it was kind of like, okay, I started really simple with the LDA, and when I got more comfortable with that, we started adding more antigens. And thank you, Dr. Keller, for being willing to make space for the 5 million bottles that we have to use. Well, and the investment of creating we have to make serial dilutions of everything we get.
Well,
which
thank
keeps
you
growing.
to you for pipetting them. So every dilution she has to
You have to
dilute.
measure
So
very
each little ball,
specifically.
yes. I don't know how your wrist held up, but yes.
That's a whole nother stem cell talk. And, just I wanted to give a moment of thanks to, Edge Pharmacy, who's making those and provides us with some of the different ones, Global Immunotherapy and Dr. Vincent's work, Dr. Harani again. Leslie Tatum also is another colleague who we're going to learn a new technique shortly here. She's coming out to the clinic with us. And she kind of was inspired by Dr. Klinghardt and Ruggiero, who came up with what's called the RK protocol. And they ultrasound people's bodies and then found that they could find things like Lyme that wasn't showing up by doing this vibration and getting the bugs out of the compartments of your body. And Leslie said, well, why can't we do autologous LDI? Because it's got everything they could be allergic to in it. I'm like, well, if they're actively infected, yes, or they've got, but it doesn't have antigen. So we're going to play around. She's going to be joining us either in December or January to do some of this, and I am committing and buying an ultrasound so we can make it happen. And then again, just without my friends and family and all of you guys, patients, etc., I wouldn't be where I am with this. So what is happening with an allergy response? So I loved this. I was like, it's simple. We've got all kinds of different things happening. We've got our different, macrophages are supposed to go around and eat different things. We have different cells that are letting out, complement factors. Should I get inflamed? My T regulatory cells, my inflammatory cytokines, my mast cells. And each of them have all these different, things that they're kind of putting out into our system. Cytokines, histamines, different kinds of complements, energies. And when we start to look at the body and just pulling just one of those out, and histamine, you can see we've got all these types of H1, 2, 3, 4 histamine that affect things like our neurotransmitters. They affect our energy capacity. They affect whether we could make acid to break down our foods, how our muscles are going to work, how our hormones are going to work, how much permeability we have, what our heart's doing. And so you can kind of see allergies sort of affect everything in our body. And even up into, this is more of the symptoms we often see with it, and it could be anything from how your heart's doing, nausea, headaches, dizziness, vertigo, anaphylaxis, meaning you quit breathing or your throat fills up, lots of skin issues, sometimes it's diarrhea, stomach cramps. It can affect your hormones and how your menstruation is working or not working, as well as how you breathe or congestion. So even if we just focus in, and this is where Dr. Harani and I came up with making histidine and histamine as one of the things, because when we start having it flowing too rapidly in our bodies, it's almost like when you get new shoes and you've rubbed your blister, then anytime it touches it, it hurts more and more and more. And then you look at those shoes and your foot hurts just looking at them. That's a little bit of how the histamine response kind of grows. And sometimes this is just talking about certain nutrients we kind of need. If in B6, magnesium, copper makes, and this is a genetic, to make it break down. And many times we're deficient in some of these nutrients. So it's not just a simple thing of one part or another, and how our genetics tie into what we do with histamine makes a big difference too. And we've got a lot. It's not like, sometimes I want to always bring it back to, wait, don't feel like the world's going to hell. It's not that bad. We've got things to do. Our diet, there's supplements, reducing our electromagnetic stress, using biofeedback to retrain our body and get our cortisol levels down because we're not in fight or flight. Acupuncture is amazing, hydrotherapy, foot baths, and of course there's medications too But if we do nothing, it tends to get worse and worse and worse. And, you know, I've been in medicine for about 30 years now, and I don't remember mast cell as often as I see it now.
The last
and
10 years, maybe 5,
the
10
last
years?
10 years, it's really, the last 5, it's certainly blown up. So we have to kind of look at, you know, what is creating so much more stress and how can we roll it back?
Will you explain? I don't know that everyone knows what mast cell disease is.
So mast cell, well, what we were talking about is mast cell disease kind of happens after you've had this chronic elevation of different histamines that are just always in your body, and the cytokines that are always in your body. And what it does is it makes those different cells are hyperactive, and you become basically reactive to everything, whether it's breathing, whether it's laying down,
Touch,
whether
being
it's
touched.
thinking,
Right.
whether it's food, whether it's, you know, a tag in the back of your neck scratching. You know, it doesn't necessarily mean you're allergic to the tag, but even just the histamine reaction that happens. And unfortunately, it really affects the cardiovascular. So a lot of these people also get POTS, or they can't keep their fluid volume regulated correctly. So we want to just be careful and not let things go this far. And so let's talk a little bit about low-dose antigen therapy is things that are outside of our bodies. And, you know, we have things like foods that are, and what's kind of nice with foods is you don't have to do, it's not like traditional desensitizing where you have to do one food for 8 months and then another food for 20 months and then another food. Antigens look very similar. They're like locks and keys, and so it's all the antigens. And the fact that the antigen for gluten looks the same as the antigen for coffee is fantastic for those with Hashimoto's who aren't supposed to have either, you know, and yet sometimes need it. So we start with things, oh, and I got my math wrong. Sorry about that, I see that. Low dose foods is 10 to the negative 13th, which means it would have 26 zeros. I don't really know what that number is. Medium dose foods is 10 to the negative 9th. So instead of where traditional desensitizing will often have very severe reactions that often need, you know, pretty big interventions, for the most part, we've had a much better result. And for those, and there's a critical list of what do we need to look at that would make us more concerned, about people having reactions. And so these are the little vials, and where I was told no one ever had an anaphylactic reaction to LDA or LDI ever, we have since informed American Academy of Environmental Medicine and some of the gurus that teach it that no, we've had a couple, and luckily we've got a great staff that can handle that if that's happening. But if it's someone that I think that's going to be, I'm not going to give them 10 to the negative 13th. I'm going to give them 10 to the negative 20th, which in reality, Avogadro's number is 10 to the negative 23rd. There's nothing in there. It's
right.
Pure energy. It's pure light. But sometimes that's enough for some people.
I like to explain it that it's water molecules that were near water molecules who learned about
They heard they were bad.
Right, bee venom from some other water molecule.
Yes.
By the time you've diluted it that much. It's kind of
And one of the things that I've learned too is if in doubt, we can also do it topically before squirting it under the tongue. So the dendritic cells are in your skin, under your tongue, and we'll get to that a little bit more. And then Dr. Vinson really kind of found another interesting factor is because these are mixtures of all the different foods, that dosage might be great for all except for one that's in there. So there's also certain things that are more hot topic items like gluten, like corn, like artificial colors that he actually made separate. So this might be the perfect dose for most foods, but it might not. And we can also go, okay, we just want to work on gluten or we just want to work on corn. And the other thing we see a lot more is the EOE, which is eosinophilic esophagitis. And, you know, we've had some pretty interesting things when we ingested corn. because so many people have had such high exposures to genetically modified corn or corn syrup. It's in so many different things that we had to separate out the foods because they were reactive to the food mix. But when we diluted it enough and did a separate one, even more dilute of the corn, we started seeing some good results.
Can I say something about
Yes,
the food?
please.
So for those people who went through our LDA treatment when we first started and had amazing results and now went away, I mean, like, they're not coming anymore. If you're still having issues with food, we've bought a ton more advanced stuff. So what she was explaining here is that we started with the low dose food and the medium dose food, which includes all of that. But since then, Dr. Ty Vincent has sort of come up with some extra ones that we went and bought. So
Dozens of extra
right,
ones.
okay, we have a lot. So that if you felt like, oh, that totally helped, but I still got this issue with corn, what you need to know is we actually have a solution for that now that we didn't have when you started.
Yeah, definitely. And yes, ma'am.
Is it okay to ask a question?
Please.
Yeah.
Well, I guess you haven't gotten to the inhalants yet, but artificial fragrance?
So artificial fragrance is usually in the chemicals and or inhalants and or environments. So again, we've got a few different ways of looking at that and teasing it out. And then I've also gotten better at making remedies also.
Yeah.
So if we know that it's this one kind of fabric freshener, but all of that stuff should be in the chemicals already, because they were pretty extensive in how they mix that. And then Dr. Ty kind of got, I mean, he's pretty into pulling a lot of these different pieces together.
But basically, so if you knew, if it was a fabric softener or your dog or whatever, you could bring that in and she can do something for you.
It's more like being around people who
Have it on them.
Bad
Bed Bath and Beyond.
So that's what
really.
no,
And they come
or
to my house to work with my son, and I'm like,
the candle shops, yeah. So that would usually, what I found, because a lot of people have that problem, is a mixture of doing the environmental and the chemicals and the inhalants, between doing the three. And sometimes I play with volume. So instead of doing a standard volume of each of them, I might do 2 IUs of each of them instead of 4. So we're not overdosing the person, but we're giving them a broader
Let's be
spectrum.
clear, we're talking about what's even.
I'm going to show you in a minute.
Yeah, no, I mean just like it's not like this.
No,
Right, they're
it's
micro.
exactly like this. We use an insulin syringe, and basically the standardized dose is 4 IUs of your antigen. But that's just a lot of this isn't the dogma that was taught, it's what works. So you might need 0.1. I can't really go much smaller than 0.1 because it's so little, it's like half a drop. But it might be that we do it topically. So for my super sensitive, I start topically, and if that's fine, the next week we do a quarter of a dose orally, half a dose, 2/3, full dose. So we work our way into it versus, I think about it like salting a pot. I'd rather add more salt than over salt it and need to throw the whole thing out and wait for the 8 weeks to try over again. And we'll talk a little more too. So immunotherapy are more things that are usually inside our bodies. These are infections. These are hormones. These are, cytokines and histamine and histidine. This is like collagen, and the list goes on. And anaplasmas are things that don't even have cell walls. And so there's, Dr. Vincent really has made that a lot more fun to play with. And, sometimes this is more of Dr. Karima, is sometimes if you see certain kinds of symptoms, we'll think, oh, let's try, a parasite mix, or let's try a Clostridia mix, or the Lyme mix is a good thing to try on people to rule out that they don't have it. If I give you a low dose of Lyme and you have no reactions, you don't have Lyme, And we find a lot of the Babesia is more emotional, whereas Bartonella is often a lot of pain kind of related symptoms.
Andi?
Yes, please.
Is that, so if you have issues with medications that you're taking or have taken in the past? Would that be an LDA or an LDI?
That would be more of an LDI, and that would be more of like a residue cleanup type of thing. And I do have a few people that we are kind of experimenting. I don't have enough data to say yet, but with the Cipro and the whole component of tendonitis problems after using Cipro and trying to see if that can help. There's also some other laser treatments that work really well to sort of detoxify the body. That's Dr. Cowden's work originally with the laser detox that can be done with that too.
Before LDI, don't you normally start with LDA on people? Don't you sort of start with the basis, or not always?
It's a great question.
Thanks.
So sometimes what I think about is, well, I'm going to get to that in just a minute. I promise I will answer that for you. So autologous is made from your own fluids. So this is one of the things we've seen that's kind of a strange one is we have a lot of kids that have very stubborn warts. And we've been able to take scrapings of their warts and have them like pretty much clear up. And I loved, my favorite dad quote was, I hate it when that hippie blank works, you know, because he was like,
That's not gonna work.
His mom had came in and she was feeling better with her inhalant allergies. So she's like, hey, can you help my son with this? And I was like, let's give it a try. And we've had good luck with some others. Some people it doesn't always, you know, it hasn't been 100%. But she was and Dad was like, that's crap, that's not gonna work. And she was happy to share his response.
Right, and I mean, one of the warts we did that cleared up, I had tried everything. They had seen dermatologists, we treated for like 4 years with tons of different kinds of treatment.
Burned it every way possible.
Right, used blistering, I mean, just like everything, and we were about ready, we were just gonna stop treating, and we said, well, I don't know, why don't you try this? And it went away, they all went away.
Yeah.
Like after 4 years of trying.
And it was pretty quick.
It was, I think it was treatment 1.
It was pretty wild, yeah. And so what is going on? Like, how can this possibly be working? The theory is that we're retraining T regulatory cells to tolerate antigens. You know, life is really about tolerance. It's not how to mount an immune reaction and go fight and kill. It's like, how can I tolerate my bad neighbor? And a lot of these things are like a bad neighbor that's not going anywhere. You've got it in your body, you still have to breathe, you still have to eat, you still have to deal with people with stinky stuff on their clothes. And this helps us kind of find a way of doing it. It looks like T lymphocytes are a little bit funny. Their memory span seems to be about 7 to 8 weeks. And they don't really like being told what to do more often than that, or they get cranky and you kind of flare and have a reaction. So I often tell people, you know, if you're not going to do at least 6 doses on it, you probably shouldn't even bother starting, because we don't want to get you halfway trained and then make you more reactive or less reactive. We want you less reactive. And, you know, but some people find, I was good for 4 days and then it kind of was like back to normal, or I was good for 3 weeks and I was back to normal. What I'm finding is in the beginning, some people need a little bit more boostering. So we don't give the same exact dosage. We give a 1,000 times more dilute dosage. Hey, remember we're walking to Renton today. You know, it's like helping their body see that with the booster effect. And then I also sometimes play with volume. So instead of, it's like I did really good for 5 weeks. So instead of giving them 4 IUs, I'll give them 5 or 6 or 7 IUs. So it's like that middle range of not going more strong, but helping to just make it last longer. And, you know, one of the things I've learned through everybody being patient with my trial and error is 1 antigen at a time. If we do 3 antigens and you react, we don't know what you reacted to. So, and if you have a reaction, let's wait a few weeks and before we try the next antigen. And a lot of people do need multiple antigens. And once we've gotten your core dose figured out, we put them all together. But the beginning few months is a little bit of the work where we have to really figure out what exactly is your dose. That's your core dose. Originally, it was taught that you had to give each one of these separately as a subcutaneous injection, and it hurt like crazy. The beta-glucuronidase was extremely painful, and the way that they've switched with some of the different antigens, I didn't really feel comfortable injecting those. But then we were thinking about it. Dr. Vincent had talked with another colleague of ours, Dr. Gus, and dendritic cells are in your mouth also. This is why children take everything and put it in their mouth, and that helps them build an immune system that is tolerant to all these things around them. That's part of why they say if you have a pet in your home in the beginning, your kid has less allergies. Well, you're licking that pet, and that pet's bringing all these other things. I mean, I caught my daughter licking the inside of the lip of our dog, and it was like, oh baby, don't do that. But then I was like, don't be queasy, Andi, like she's building her immune system. So a normal dose is 0.4 IUs, and we squirt it underneath the tongue and hold it there for 30 to 60 seconds. How do we figure out what to do? So there's certain parts of a history that are super important. What are all of your symptoms? People often want to categorize, oh, my fatigue has nothing to do with my allergies, or my sore knee has nothing to do with my allergies, or my sleep problems have nothing to do with it. It's like, what are your chronic allergies? We'll sort it through, because what might work for 3 or 4 of those symptoms, when we start to see patterns, will direct us to what else might be needed. Chronological order is super important. If something happened after the first symptom started, that later thing didn't cause the earlier thing, even though sometimes it can feel like it did. Because sometimes I'm not rational when I'm thinking about, my symptoms. And so we have to also what was going on? Was there a bad flu? Did you have a case of mono? Did you just go back to school and get exposed to a bunch of strep? Oh, did you have a spider bite? Okay, so these things are all lead us down to what's really going on. And how did you respond to different interventions where, it's like, well, I had a horrible reaction when I tried doing IV nutrients, but I did really good when I did probiotics. Then I would, look differently as to what to choose. Lab values I find super important also, because we don't expect our body to stay chronically irritated with things. I'm exposed to Epstein-Barr, my titers go up, their IgM, then my IgG goes up, and then it should come back to normal. It shouldn't stay up 800 times higher than normal for the next 10 years because I was exposed. It's like, no, your body's still irritated with that thing. Mold is tricky. We do have symptom surveys for a mold survey, or Horowitz has a nice tick-borne illness, or Armin Labs has a really nice symptom survey. But if you're still in a moldy house, it makes it hard to know, is this mold current active exposure or allergy? They're different things. We can downregulate your reaction, but if you're chronically breathing in black mold, you're chronically going to be inflamed no matter how much LDA we do on you, or that would actually be LDI. And, so symptoms can come, and the other thing is, when you start going to medical school, it's crazy because you start thinking you have every single thing, because one symptom could be involved in 20,000 different illnesses.
Yeah.
So it's hard to you got to look for combinations of symptoms. I do some muscle testing. Autonomic response testing was developed by, and this is usually not so much to tell me what to do, but you've got 4 different things and I have to decide, what do we start with, and how do we progress with this? And so Dr. Klinghardt and Dr. Louisa Williams, developed this. I teach it to physicians. It's usually a 3-day class, so I'm going to give you the barest bones Reader's Digest version. We're evaluating the light emissions of your body. Basically, Dr. Pop's work has showed us that healthy cells communicate via light. Light has a pattern of being coherent. If it's not, then something's wrong. and we could look at infections this way and how your body's working. Jerry Pollack is another wonderful physician that we have at University of Washington, who is a water specialist, and his amazing contribution to medicine and physics is that in every cell of our body there is water, and water has what's called an exclusion zone, which actually generates electricity. So it's part of like how our blood moves through our body. Like our sweet little heart is a pump, but it's not strong enough to do all of that on its own. And so when there's a phase shift, there's a change in the strength of the muscle. And so I always like to tell people and the doctors, you know, ART is one leg of a three-legged stool. So it helps us know what to do, but it's not the only thing that we want to use. The biggest thing is how you as the person getting the treatment respond and how your symptoms respond. And so that's going to be the most critical, and you know, the history and what we're doing. So a lot of people want to know, how often do I have to mess around with this? In the beginning it's a little tricky because we have to find your core dosage, but after we find it, we go somewhere between 7 to 12 weeks, and it gets longer and longer. As you train those cells, they don't need to keep being trained as much. Like my daughter now, we usually do once or twice a year dosing, and that's about it. And I could tell she starts getting puffy when she eats. Like there's certain little traits that I know are her symptoms. And as you start stretching longer, like after those first 5 or 6 doses, and you're like, I'm like, well, come back in when your symptoms return. But come right when they return, not 6 months after they return. Because if you wait that long, it's like starting the process over again.
People forget they've been symptom free for so long. Their symptoms come back, and they'll often call me and say, I'm having this symptom, and I think, wait, didn't you do LDA? And they're like, oh yeah.
Yeah.
Like,
And we
it's been
do
gone
another
for so
dose,
long.
and I'll see them in
Yeah.
another 6 months
It's
when
pretty
it comes
cool.
back.
Yeah.
And, you know, so, and then also the booster doses could be a little bit more often in the beginning until that core dose has really done its job of educating the body. So one of the things that's super tricky though is knowing your symptoms and listing them and kind of knowing what your normal range of bad is, because it's always a range, and it's hard to remember, like, okay, but the bottom line is your worst state, if it's getting worse, we don't want you to suffer. We're going to intervene. Some people have taught that we watch how long you suffer for and do this mathematical, you know, Sudoku and then like change the dilution. And I'm like, no, that's not going to work for us. I don't want to do that. And so it's going to be super important to know what your range of symptoms are, and then you have to write it down. It's a hassle for that week after you do your dosing, but all you have to tell me is it's the same, it's better, or it's worse. It's not undoable. And I'm going to show you a little bit of what that looks like. So you get this thing. I couldn't make the whole form, but it basically says, rate the number value of what your chronic symptoms are, write them all down, and if something new comes out, you add that to your list. And then you simply track and let me know it's the same, better, or worse.
That's what the form looks like.
And then you
that
get a
other
little
was
thing, and
key.
so we put in the date, we put in what you got, we got how much volume you got, and you just, all you have to write is SBW. So it's pretty simple. And if you start having worsening, you basically want to let us know. We start with using trisalts, which is similar to doing Alka-Seltzer Gold, which is a long time allergy go-to trick to alkalize the system and reduce inflammation within the body. A lot of people like doing the ionic foot baths. Vitamin D is actually a hormone, and we're going to do a whole nother talk on that too. But it works similar to prednisone to suppress the immune system in a higher dose. And what we do is we give you a pulse with it in a higher dose to get that down. We use a spray called Allerbalance for some people. Some folks do well with dye-free Benadryl, and that is to body weight, you know, so we've got a little chart. You can kind of measure that up too. Glutathione can be really helpful for kind of clearing that phase 2 liver congestion, especially when we're treating some of the molds or the viruses or these other things, because your body also starts dumping some of those toxins. Vitamin C is just a great antioxidant. Fish oil is also anti-inflammatory, and we do give you prednisone prescription in case that's needed. Although we did just get some great information about some of the new peptide strategies, and that'll be another talk coming up. But we keep learning more strategies so that people don't have to suffer through this process, because that kind of defeats the purpose. So that's kind of the overview of all of it, and I've been really happy. I wanted to show you a couple of things. So this is what the little bottles look like. So this is my joy. We do these serial dilutions
She made them.
of all of
Yeah.
these, and I have literally hundreds of these bottles. And it's kind of interesting, like UTI sounds like kind of creepy, but it's actually Proteus and Klebsiella. Proteus and Klebsiella are very linked in with ankylosing spondylosis.
Yeah.
And so there's no treatment for that. People are just like, yeah, suffer, sorry about that. I had some homeopathics from Germany with histamine, and I got histidine. So you remember in that histamine metabolizing to help downregulate both of those aspects of the histamine. So what a dosing looks like is I will put the different antigens in. It does have a needle on the end of it, but I don't poke anyone with this. I'd like to just show you what it looks like.
I was due for my dose. And
So basically you just open your mouth, you lift your tongue up, and you just squirt it right in, and then you just hold that under your tongue. And I have this actually on a paper, her symptom tracker, all written down. I would give it to her. So
and I would fill it out.
if you write S and put a line all the way across it, I was a teacher. I do know when you've kind of jammed your homework at the end. It doesn't serve either of us at the end, but it's that simple. And it's one of those parts. I mean, do you want to share
Yeah,
your
can I give
experience?
some? Oh my gosh. So, this is like, okay, I always feel like maybe we have 100 tricks, right? And that works on 70% of our clients, and then they're feeling well. But there's this 30% of our clients that aren't well. And so then we learn a new trick. Oh, sorry. And then we learn a new trick, and then we can help another 10%. And then for those, so that's why we keep learning. And one of the things that I think probably the single most thing that I'm grateful that you brought to the clinic, well, except for you, but is this low-dose antigen therapy. It has helped so many of our patients in a way that Western medicine just cannot. I have kids who were anaphylactic to milk, who ended up going through the process, and then we challenged them with milk here, and they can have milk products. I have a kid who was allergic to a lot of things, but one of them is dogs. They now own a dog. My seasonal allergies are so much better. I can eat food sometimes. So from even sort of so if you have allergies, this is amazing. That's great. Also, we have a subset of people who are really, really, really sick, and this can help in ways that anything else can't. I had, I had adrenal insufficiency, so Addison's disease, and I was on a high dose replacement for my adrenals, and in fact, even, I don't know if anyone here, but I had to see some patients laying on the floor because I could not sit up, and I ended up in the ER a bunch of times. It was like cardioconverted. It was just really a mess, and I kept working, and I was thinking, I don't know what I'm going to do. And Nurse Andi gave me LDI
LDI
for Epstein-Barr virus, and I thought she was just going to help me with energy. Within 2 days, I had to come off of all of my medicines acutely. You don't do that in Addison's disease. I was like on blood pressure medicines to increase medicines to increase my blood pressure, medicines to support my adrenals. And I was pretty scary sick. And then within 2 days, I had to be off of all of it because I got better so fast that I was hypertensive and completely normal. And I went back to completely normal. I don't really understand how she did that. Now every 7 weeks, I start to get a little run down, and it takes someone around me to go, like, didn't you want to go get that thing again? So I was due for my treatment, and she gave it to me here. And so, and then actually I used that same treatment on a few of my kids who would end up with adrenal insufficiency, and I don't fully understand. I don't understand that. It works.
That's called insomniac evenings, and you're drudging through lots of research documents. And there was a research document that in a research thread that I tend to be hesitant to just delete because like there's always those pearls. And there was an article about how Epstein-Barr was related with POTS, and we have a lot of folks that were having that issue. And I was like, well, I don't know, let's try it. And that's what I mean by sometimes I'll see research, I know what it theoretically means, but then it's been really wonderful that we can find ways of safely trying those things out, because we have to be careful that way.
So I think what's so neat about this therapy is there's really such little risk, right? Like if you're an anaphylaxing patient, you could anaphylax. Well, we're going to do it here, and we're going to watch, and we're going to help you if that happens. But for the most part, the worst I ever hear about, like they might feel headache or fatigue a little bit or a little itchy. They're like, this is not a high risk treatment.
No, and there's a checklist that I go through for the high risk folks, and it has grown a lot. And then we go just much more dilute, and we don't let it just get out of. It's like a wildfire. If you stop it right when it starts, it doesn't go crazy. But if you try coming 3 days later, it's too late.
Right. And so it's this amazing treatment if you have sort of mainstream allergies. And so that's part of why I wanted her to redo this talk, is I feel like there are people who I still hear about their allergies who didn't even realize we were doing this. Or maybe when we started doing it, we were saying, like, there's this really cool thing I think might be interesting to try. Well, 4 years in, we know it works. But then also this other side that you can cure, my Addison's disease with a silly little squirt under my tongue just makes me crazy.
Well, no, you cure your body's misled response to a virus that's not going to go anywhere.
That led to adrenal
So we're never going to get rid of all of your Epstein-Barr, but we can make you tolerate it.
But you cured what
symptom-free
ended me up in the ER, unstable cardiac positions.
Yeah, we don't like it when you do that. So you need to be at work
with a silly little thing. And so and so really, even if you think this is something like, I would not have said I should come here for for this treatment for Addison's disease. I was doing all of our other treatments for that. So if you have something that isn't getting better, something that the rest of us haven't been able to solve, I think it's worth at least a visit with Nurse Andi to sort of see if she can come up with a solution, because she does. And then this idea that we're going to do next, right, that sort of to take the immunotherapy even further, maybe I don't know exactly what it is that's causing my problem, so she does an ultrasound that like kind of shakes your tissue, shakes out whatever it is that's irritating your system. You collect that in your saliva or whatever, and then make a treatment out of that. Can you understand how that is like this whole other level? And really, people are not really doing, this is
it's German functional medicine. Yeah. It's been around.
This is cutting edge.
I didn't come up with it. And
leading edge. Bleeding edge. Bleeding? Is that what they call it? Oh, kind of like that. So, I just, I don't know that everyone understands what a resource we have in Nurse Andi. Right.
Thank you. Love you too.
So thank you. I really think that everyone should think about trying it. It's pretty remarkable.
Yeah, it's been, I wouldn't have known of it had I not done it for my own child, and it's definitely been an evolution, and seeing, and then also my husband is a Boeing engineer who thinks all of this stuff is very entertaining. That's nice, sweetie, go have fun at your work. And yet, he also suffers from some pretty severe chemical allergies that he's developed through years of working with chemicals and allergies. And You know, and he's like, all right, would you give me some of that drop stuff because my nose is running? And I'm
Hate it when
like,
that
yes,
hippie
love,
shit
I'm
works,
more
huh?
than happy to do that. So it's been fun to just kind of watch folks that, you know, it's not placebo on those guys because, like, they're just so not interested
Well,
in making you.
There's really good science behind this.
Yeah.
Like, I mean, it seems a little crazy because we diluted this thing and we gave it to you and you got better. But I mean, there's actually, it makes sense.
Yeah. And I did it was really nice having Bastyr residents. I have to have great gratitude for their capacities to find, and Erin, my sweet Erin, basically found all of Dr. McEwen's original papers in their entirety. So I do have those at nurseandy.com in the LDA section, and some other videos from people, as well as I'll have this one up. And, you know, so we're trying to continue to, you know, bring the data that we gather and keep having it out there for all of us. So thank you. Do you want to maybe stop and then we'll do some Q&A? Thanks, guys.